Welcome to the award-winning Women in Healthcare Leadership podcast series brought to you by Medscape Education. Our mission is to educate, advocate, and inspire women in healthcare to lift as they rise. Each episode brings you voices of leaders who are breaking barriers and leading the way in advancing women's health. Join our global community of listeners as we hear from her. Ready to be part of the movement? Let's dive in.
Hello and welcome to Medscape's Women in Healthcare Leadership Series. I'm Karen Reid, an Executive Director at Medscape Education. I'm delighted to welcome two outstanding guests today. First, Salagna Bhattacharya, the CEO and co-founder of Nanoscope Therapeutics, a biopharmaceutical company developing gene therapies to cure genetic diseases that cause vision impairment and blindness. Welcome, Salagna.
Thank you, Karen. I'm happy to be here.
And I'm also delighted to be joined today by Usha Chakravarti, Professor of Ophthalmology and Vision Sciences at Queen's University in Belfast, Northern Ireland. Usha is internationally acclaimed for her research and clinical excellence in the preservation of human vision. Welcome, Usha.
Delighted to be joining you, Karen.
So, thank you both for being here today. There's lots we want to discuss, and I wanted to start our conversation with a little bit about your career and your personal journey. So, Solagna, let's start with you. Can you tell us what led you to the field of ophthalmology and becoming a CEO?
My journey into ophthalmic biotech wasn't traditional. I'm not a physician, but it is deeply personal. I co founded Nanoscope Therapeutics with a mission to cure blindness, particularly for those with inherited retinal diseases like retinitis pigmentosa, Stargardt. I grew up witnessing a close family member going through the devastating journey of RP, watching how vision loss affected his daily life and disconnected him from the world left a profound impact on me. As I met more individuals facing progressive and permanent vision loss with no hope of treatment, I became determined to help find a cure. I have always been fascinated by science. By background, I'm an electrical, electronics, and communication engineer. I wanted to do more than just studying it. I wanted to apply it with purpose. My parents instilled in me a drive to make a meaningful difference in the world, and I saw an opportunity to bridge innovation with impact. Retinal diseases rob people from their connection to the world, and through Nanoscope, we aim to restore that connection.
Thank you, Salakna, for sharing that and your lived experience and the observations that inspired you. I want to come back to retinal disease, but I also want to ask Usha for her journey. So, Usha, you're one of the leading retina specialists globally. So, tell us a bit about what prompted you to go into medicine and specialize in retinal disease.
My entire family are physicists and engineers. So, in fact, medicine was a slight departure from the norm for me. I guess really I was intrigued by the science underpinning biology and chemistry and bringing it together. And I thought medicine was a good marriage in terms of a sort of a holistic view and understanding of how cells work and how human diseases affect us. So medicine seemed a natural career for me. And in fact, I started off in general surgery and accident and emergency. I never had any thought of going to ophthalmology, but I soon realized that surgery with all the blood and guts all around you was not really ideal. And I preferred some kind of precision approach to treating patients. So ophthalmology seemed a sort of a natural pathway for me to take, particularly since microscopic surgery was just coming into its heyday. And you felt very much more in control of anything you were practically doing to a patient. And another aspect of it is, in particularly in retina, it poses a lot of diagnostic challenges. And I've always felt that um, having the sort of the background in physics, chemistry, and mathematics. I like logic, so I like to sort of go from A to B to C to D in a stepwise fashion. And so, the sort of the diagnostic challenges posed in retina was very intriguing. So this is why I guess I drifted into retina and into the practice of retina.
Fantastic. Thank you for sharing that. So, looking a bit deeper into retinal disease, then, and specifically retinal degenerative diseases, Usha, what would you say are the biggest challenges today and unmet needs for these patients?
If we think particularly about retinal degenerative disease, the most common degenerative disease that affects us, in fact, throughout the world, is age related macular degeneration. And there are, of course, we now have wonderful treatments that can be used to manage uh, the form of macular degeneration known as neovascular macular degeneration, and in lay parlance, wet AMD, when we can control the exudation. But we still haven't got really effective treatments that will stop the non neovascular dry form, which accounts for a huge proportion of the visual impairment in older adults. So we do need really good therapies that will stop this atrophic process that affects the macula of the eye in its tracks, not ones that just reduce the expansion of the area of atrophy growth, which is the sort of which is what the current treatments do. So we find that despite our best efforts, yes, we are better off than we were a decade ago in terms of managing age related macular degeneration. And we have reduced the levels of blindness, but we still get significant visual impairment from wet AMD and very significant visual impairment from geographic atrophy, the non neovascular form of AMD. So we need better therapies for wet AMD that will prevent the secondary consequences, which are still present despite our treatments with anti-VEGF agents, and that is fibrosis and continuing atrophy. And we need treatments that will prevent completely any progression of the atrophy in the non neovascular form. So these are our major challenges right now. We also, in terms of age related macular degeneration, we need more precision medicine. We need to, we don't have a way of personalizing treatment based on the genetics and the phenotypic characteristics of the patients. We haven't done that yet. And the third point I want to make with with age-related macular degeneration is prevention. We do know that lifestyle changes and taking antioxidant vitamins can slow the development of the condition, or perhaps in a small proportion prevent it from happening. But in the vast majority, these are just sort of minor effects. So setting that aside, we also have a number of inherited retinal degenerations, and these are not uncommon. And when they happen, the phenotype can vary between one person to another with the same genetics. We also have different genetic abnormalities as well, which cause very similar phenotypes. So understanding the genotype phenotype um, connectivity is critical, and this needs to be looked at more in greater detail. Furthermore, when there are genetic conditions, replacing the part of the retina with new cells is almost impossible, because the retina is a post-mitotic cell composed of post-mitotic cellular neurons, which means that they cannot replicate. We're not like salamanders that can grow a new tail. So unfortunately, the fact that the retina is so specialized is a major challenge. But there is light at the end of the tunnel, because there are a lot of developments that hopefully are happening, and I'm sure that Sulugna is going to tell us about how some of the sort of the engineering that can be done in terms of um, replacing specific proteins in the retina, making the retina work in a slightly different sort of way can help patients with inherited retinal disorders.
Usha. So, Silagna, help us understand what is the experience like for these patients, and what are some of the new approaches to address some of the unmet needs?
Absolutely. Very well said, Dr. Chakraborty. Like, retinal diseases are incredibly complex, and like, especially if you look at inherited retinal diseases, like even RP or Stargardt, that caused by hundreds of genes and thousands of mutation, so making them extremely difficult to treat. This condition often lead to vision loss at a very early age and devastate the quality of life. And historically, as Dr. Chakraborty mentioned, there is no like curative treatment, only kind of symptom management or attempt to slow the progression. At Nanoscope, we are focused to restore vision back to this patient. We are changing that with optogenetic therapies designed not to just stop the vision loss but to restore sight. By introducing light sensitive protein into retina, we can reactivate even dormant retinal cells like bipolar cells and making them this patient's new de facto photoreceptor. It's a new treatment paradigm, one that allows people who are legally blind to potentially perceive light, shapes, and navigate spaces again. The future of this field is shifting from preservation to the restoration, and that's the power of innovation I'm seeing happening in this domain.
That's great. Thank you for sharing that. That's quite exciting. And I think people will be struck by that, the potential to restore vision and actually help some of these patients see light again. So I wanted to talk a bit also today about the element of leadership. You've both become female leaders in the ophthalmology world. Are there barriers to women progressing into ophthalmology leadership historically and today?
Were major barriers to women even a few decades ago because ophthalmology was seen particularly as a surgical specialty, requiring long hours of work, and requiring an extensive training program. And of course, women have traditionally always been the homemakers and the child carers and providing childcare and being on call at every few days in the week did pose a lot of challenges. However, certainly in the UK, which is the place where I have trained, faced most of my career, things have changed quite dramatically. There's a lot of effort being put into helping young women coming into ophthalmology maintain their career structure, giving them sufficient time to take off while their children are younger, and allowing them to maintain their surgical skills, retrain if needs be, and bringing them back into the workforce. So, yes, there were major challenges in the past, but these are less so. Of course, there'll still be locations where it might be much harder for a woman, particularly if it is not in a large unit where there's sufficient workforce to support this kind of, um, uh, how shall I phrase it, to support uh, the kind of programs that we have to keep the young female workforce in the system motivated and progressing. Outside of the UK and in Europe, I have been told that it's definitely much harder for women to assume leadership roles. But having said that, we're aware of some very prominent leaders who, have major positions in some of the bigger retina societies, and we all of us try to get together and to encourage um, younger people to come into the specialty and support them through any difficulties that they may have.
I think that's so important. So finding supportive communities and collaboration. Can I ask about mentorship? Usha, did you have any specific mentors or sponsors that helped you in your career journey?
Oh, absolutely, yes. Remember that my career started at least 2 decades, possibly 3 decades ago, in terms of moving from a training position into a trainer role. And at that time, my head of department, was a very, very um, erudite and extremely knowledgeable and very supportive person, and he was excellent and recognized my strengths and my weaknesses and helped me navigate the the role that I was sort of, aiming for. And that was immensely helpful. The fact that he recognized that I was very keen on research, that I was also motivated to go into the field of retina, and gave me the necessary support, as well as helping me navigate any pathways that sometimes are not easily visible to a young person embarking on that career.
And Salagna, so you're a first time CEO. As you reflect on your own career of becoming a female leader, were there any challenges that you faced along your path? And were there any mentors or support groups that particularly helped you in your journey?
Absolutely. Like, as Dr. Chakraborty said, historically, like medicine been male dominated field. And if you come to biotech, it's traditionally male driven, but changes are happening. Like there are support groups coming, like women in retina, women in ophthalmology, and some of the industry organization like bio CEO sisterhood. These are amazing organization, and the networks, they're just more than professional circles. They are like places of trust. You're learning from each other, sharing experiences, and that's how you grow. Within this group, we speak candidly about leadership and about life and the challenges we face. We celebrate wins, we share lessons, uplift each other. Especially like sisterhood in particular, it's been source of strength and solidarity. I have also had like incredible supporters and mentor, both men and women, who believed in my vision and supported my leadership journey. But not everyone has access to this kind of mentorship, especially like women coming from underrepresented backgrounds. So when women support each other and organization commit to inclusion, we see real progresses. Like balancing family and career, still there are challenges, but within the right support, it is possible to strive.
Thank you for sharing that and for all of those really important support groups that are there for young leaders to help them move forward in their career. So, I wanted to ask both of you, what is your top piece of advice for women entering the field and wanting to become a leader?
Be yourself, be confident. If you encounter a challenge, do not immediately think that it's because you're a woman. It is because the challenge happens to be that can be completely unrelated to your gender. And talk to other people who have been in the similar situation in the past, and consider any advice that is given. Go to many sites. Don't just concentrate on getting information from one or two people. um, Talk to all the others that are there in the field who where you can see that they have achieved what they set out to achieve, and see how what advice they can give you. Synthesize it and work your way around the challenge. Never become aggressive. Never ever become rude, or um, and do not uh, and don't personalize issues. Try to look at it from a more broader perspective. Generally, things would do work out, and in my view, particularly if you're going into academic medicines and roles, you do need really good mentors and sponsors in your local area where you've decided to make your career, because they are going to be so critical in helping you get to where you want to go.
Absolutely. Great advice. And Salagna, for you, what would be your top piece of advice for women wanting to go into leadership in pharma or biotech?
Don't wait for permission to lead. Step into spaces where you see a need and bring your unique voices with you. Let purpose guide your path, even if it's an unconventional one. I'm a very mission driven person. Build your support network, find peers, like mentors and allies who believe in you. No one creates lasting impact alone, and your voice matters, especially in places it hasn't always been heard. Leadership, what I have learned, it's not about knowing everything, it's about listening, adapting, and being relentless in pursuit of your mission.
Thank you. Truly inspiring, and absolutely that resilience and that perseverance to keep going, to keep pushing forward towards your dreams and ambitions. So that brings me to my final question, and I wanted to ask both of you about the future and what are you most excited about in the future of retinal disease?
I think the movement into more precision medicine, personalizing healthcare is going to be particularly critical in the field of retina. Um, and I think the innovations that we have in medical imaging are going to be critical in understanding the pathogenesis of retinal diseases and the kind of innovations that are happening with genetic engineering, which Sulagna and her team are doing in nanoscope are so the kind of things that I find most encouraging. And hopefully, in another decade or two, we will find that we're in a situation where serious blindness and severe visual impairment due to degenerative diseases have been conquered.
And Salagna?
We are on a brink of a huge milestone in retinal degenerative diseases. For the first time, we are moving beyond just slowing down the vision loss or just managing it. We are working to restore the vision. That's revolutionary. Especially excited about the convergence of optogenetics, gene therapy, and emerging technologies that are reshaping how we treat these retinal diseases. What once seems like science fiction is now happening in clinical trials. At Nanoscope, we are working toward making functional vision restoration a reality, not in decades, hopefully within next couple of years. It's an extraordinary time in ophthalmology and especially in retinal degenerative diseases. What excites me most is not just the science, but the opportunity to bring this breakthrough um, to the patient across the world.
So, Usha, any other insights that you'd like to share with us today?
When I speak to my trainees and my younger colleagues, I often say to them, look, there may be a glass ceiling, but remember that sometimes this glass ceiling is just perceived. It's not a real glass ceiling. So you want to take a good look at what you have done so far, what you've achieved. And if you feel that you need to do more, that suggests that perhaps more application is needed to get yourself to that level where you want to be. It takes hard work. So don't be put off. Review what you've done, review where you want to go, and make sure that the glass ceiling is not just a perceived glass ceiling.
Great advice. And Salagna, the same to you. Any other insights you'd like to share today?
Absolutely. Being a female founder, I have often been the only woman in the room, and sometimes it's the only one advocating about patient left behind by traditional drug development and raising capital for a bold, patient driven, mission driven organization wasn't easy. But staying focused on the impact that we could make gave me the resilience. Seeing patient in our clinical trials, glimpse of sight that fuels me, that keep me focused. I mean, challenges are there, but we need to be focused to overcome those challenges.
Great. And thank you so much for sharing that and also wonderful advice. So I think that's a really great place to bring our conversation to a close today. I want to thank you both so much for joining. I have truly enjoyed our discussion. A number of things come through incredibly clearly. When it comes to leadership, you've both shown the quality of your character, that inspiration to lead, to educate. You've talked about the importance of collaboration, supporting other women, the importance of mentors and networks, those places of trust. As a mission driven entrepreneur, we've seen that inspiration that drove you to innovate, the sense of purpose and perseverance, which is really inspiring, and some great advice there. Don't wait for permission to lead, jump in. And when it comes to retinal diseases, you've both given us reason for optimism with new innovations in gene therapies offering the potential to restore vision and breakthroughs on the horizon. So I want to thank you both. You've absolutely inspired me today, and I'm sure all of our audience as well. So thank you for joining, and thank you to all of our listeners. And please stay tuned for the next episode of our Women in Healthcare Leadership series. Thank you both.
To our listeners around the world, thanks for joining us today. Tune in as we continue our journey to amplify the voices of women leaders in healthcare. Hear From Her is brought to you by Medscape Education. Please subscribe to Hear From Her on your preferred podcast channel and follow us on LinkedIn. Until next time, remember to lift as you rise.